The question here, a client taking the morphine sulfate for acute pain, right? So everybody know the morphine is a medication, right? Morphine is a medication we use for pain, basically. So other name of morphine is called opioid group or narcotic, right? So medication is morphine sulfate for acute pain. Morphine is a type of opioid or narcotic. So the nurse suspected the client has developed the urinary retention. So everybody know that morphine is a pain medication, but they have some of the side effect. When you study the pharmacology, I like to request you give the focus about the side effect of medication. Because of our nursing profession, we have to deal with the patient. Healthcare provider prescribe the medication, but we will be there with patient to observe any kind of sign and symptom. There are some medication in the pharmacology, they used to develop the side effect like urinary retention. So this is the note every student should know, that the morphine, especially opioid, especially morphine, has a two major side effect. One is respiratory depression, right? Another is the retention of the urine. When you're dealing with the patient who have to take the morphine, we check the respiratory rate for respiratory depression checking or urinary retention. If we see something like this, we have to hold this medicine, first of all. But before to hold, you have to make sure the patient has a shortness of breath or patient has a retention of urine. So let me recap it, my friend. The patient who have to take opioid or narcotics like morphine or meperidine, always we have to check for respiratory rate, because morphine can cause respiratory depression or urinary retention. So watch for also they can cause constipation. Is a side effect of this medicine. So if we see any problem like respiratory problem or retention of urine, hold this medicine. Always hold it. Especially some books said we have to hold this medicine if the respiratory rate below 10. And it is indicate they can chance to develop the respiratory failure. So if we go back in this question, they said a patient take the morphine for acute pain and patient complain develop of urinary retention. What are the first priorities? So we have to give them catheter, or we have to inform the healthcare provider, but according to the nursing process. First of all, come for assessment, my friend. Don't go for the intervention. Don't go for the action. First of all, assessment. Here the four options. Ask the client, need to use back pain. But you are the medical person, you are the healthcare provider, you know better than your patient. Morphine can cause retention of urine, but you have to make sure the patient has a retention of urine develop or not. So back pain is later on. It is the action. Assess the client fluid intake. I will do it, but not the priority. Because if my patient already urinary retention, if you give them more fluid, retention will be start pain. First of all, make sure what are the diagnosis my patient. Assess the client skin trigger. It is the sign of dehydration, but not now. Palpate the client suprapubic area means assessment. We have to make sure my patient develop the retention of urine. How could check it? Just palpate suprapubic area to check the retention of urine. Out of these four, according to the key point, morphine, retention of urine, priorities out of four, the number four is the best option for assessment of my patient. Here we are going to talk about some explanation about the morphine. So morphine or opioid, morphine is a group of opioid medication, right? Other opioid we use hydromorphine or codeine, hydrocodone, Mepiridine, most frequently used medication in the hospital. So in this explanation, they sharing with you some more information in pharmacology. There are three groups of drugs. One is opioid, another is anticholinergic. So anticholinergic or TCA, tricyclic antidepressant. These three groups can cause urinary retention. Let me share something with you. Opioid is a group of the drugs. Opioid. The morphine is one of the member. Other member is the codeine, Mepiridine, or hydrox or Oxycodone. Anticholinergic is a medication, is a group of medication. Most popular, most important member in this group, atropine. Everybody know. If you want to go for your NCLEX board exam, you have to know. If you do not know, I like to request, better don't go. Anticholinergic medication, we said atropine is the most important member in this group. Anticholinergic basically inhibit the parasympathetic nerve impulses by blocking the action of acetylcholine. But here we are going to focus anticholinergic, especially atropine or atrovant. They can cause retention of urine, right? The frequently asking NCLEX board question about the atropine, I will explain it in my atropine lecture, but atropine can cause dry mouth, blur of vision, photophobia, and tachycardia. Other medication is called, we use it as a antipsychotic or antidepressant, like tricyclic antidepressant, triptane. They also cause urinary retention. They increase the bladder sphincter tone and or relax the bladder muscle. The nurse should assess the client's suprapubic area to determine if the client has urinary retention is occur. If the area is distended or pull on percussion, this is the examination of the abdomen, percussion. It would be dull. The nurse should proceed for intervention. First of all, assessment is important. Next here, what are the education tools about this question. Assessing the client suprapubic area in the priority of nursing action. When urinary retention is suspected, again I said nursing process, assessment first, right? Then diagnosis, then planning, implementation, and evaluation. Intervention are performed after the problem is identified and it cause to determine. Urinary retention is an expected side effect of opioid medication. As I told you, I am going to share more information about the opioid, what basically we need to know for board exam. So the group of the opioid or other name is called narcotics or analgesics because we use this medication to relieve the pain. What are the indication of opioid or narcotics? Used to relieve the moderate to severe pain. Moderate to severe pain. The most important member in this group are morphine. Other are Demerol or Meperidine, hydroxymorphine. Hydroxymorphine. Let's go and talk a little bit about the first member here, morphine, or what are the information we need for board NCLEX exam about the morphine. So morphine here, this is the morphine here, I said. Other opioid who work like morphine is called oxycodone. The name is not here, oxycodone or fentanyl. This is also what like morphine, or they're in the group member in this group. Indication of morphine are we use moderate to severe pain, used to relieve the moderate to severe pain and promote the sedation. Patient feel good and it is help to for sleep sedation. The mode of action of morphine, they bind to the opioid receptor in the central nervous system. Again, I want to share with you the side effect. That is the really important for board exam. The morphine side effect, they can cause central nervous system depression or respiratory depression. Other side effect is sedation, constipation, GI upset, hypotension, and urinary retention. Let me read it from here. They can chance to develop the risks of dependency. If anybody take for a long time, they have a chance to develop the dependency, addiction basically, and pinpoint pupil diaphoresis, central nervous system depression, dry mouth, itching, and rash. Okay, so the key point, what we have to know about the morphine or nursing intervention here, I said always about the narcotic, the board asks a question, if the narcotic overdose, what we use? We use the antidote, is called Naloxone. So Naloxone is an antidote of morphine or opioid. So if you give the Naloxone to the patient as an antidote, we have to monitor the vital sign. And also respiratory status we will check. Admin always slowly. So sometimes morphine or opioid we use for cancer pain. Narcotics report the problem, urination, such as pain, difficulty of urinating, frequent urge to urinate or decrease the urine output, constipation, headache, diplopia, or nightmare may be the sign of overdose. Avoid with the other medication what is causes the central nervous system depression, like monoamine oxide inhibitor or antihistamine or muscle relaxant. So every information from here, it is very important for NCLEX board exam. And what are the other opioid we basically use? Here I said we use the Mepiridine, another one. What are the important note we have to know about the Mepiridine? So Mepiridine do not give with to the patient with head injury. Only one information for NCLEX board. Meperidine is an opioid or narcotic, but we will not give to the patient with a head injury. They can increase the intracranial pressure. They can increase intracranial pressure. So meperidine also can use for severe pain, especially it is used during the labor, okay, delivery or labor pain. As like as morphine, meperidine also bind to the opioid receptor in the central nervous system, and they decreasing the pain without causing significant respiratory depression to the in the mom or baby. So this is the reason during the labor or delivery we use meperidine rather than the morphine. Okay, they cause without significant respiratory depression. They do not do what morphine do. So meperidine major side effect is GI upset, sedation, dry mouth. All opioid can cause hypotension or they decrease the fetal heart rate if you use during labor or delivery. The key point about the meperidine, that labor should be well established when if you use the meperidine during the labor, and also the mom cervix should be at least 4 centimeter dilated prior to administration of meperidine. In case of respiratory depression, we give antidote naloxone, right? So naloxone is the antidote for morphine. It is antidote for meperidine. Another medication in this group is called hydromorphine. So morphine adds something, hydromorphine. Hydromorphine basically reduces the respiration, and this is not like morphine, and it is, you cannot interchange them. It is not absolutely like the morphine, hydromorphine. Hydromorphine is many more times stronger than morphine. Simply said, hydromorphine is stronger than morphine. Okay? And we do not give the morphine or hydromorphine to the patient with pancreatitis pain. Another opioid, most popular opioid I want to tell you, we use in the hospital, this is called codeine and hydrocodone or oxycodone. Codeine used as a cough suppressant as well, or take with the food to prevent the nausea and vomiting. Oxycodone has a acetaminophen basically, and also do not give if the patient allergy to acetaminophen, and it is okay to give if the client is allergic to aspirin. We are talking about the codeine and oxycodone. So as I told you here, one of the note, naloxone. So here, antidote of narcotics for morphine or hydromorphine, Mepiridine, we use the naloxone. Little bit talk about the naloxone. The indication of the naloxone are opioid overdose. They competitively blocks the opioid receptor in the central nervous system. The naloxone also have some side effect. They can cause hypertension, tachycardia, agitation, or GI upset. The key point, monitor the respiratory status and pain, right? So now I'm going to compare and contrast discussion about NSAID. It is non-steroidal anti-inflammatory medication. So name of the drugs we use as the NSAID, basically ibuprofen, indomethacin, naproxen, or celecoxib, right? Most common one. This medication we call non-opioid. They are non-steroidal anti-inflammatory. This medication we use for mild to moderate pain reliever, or we use for the pain fever medication, right? Even the NSAID we use for arthritis or gout or rheumatoid arthritis. Sometimes the NSAID has a properties of they act as a blood thinner, right? So I said the most important member in this group are naproxen, or some books said aspirin or acetaminophen, also in this group. But here we are going to trace out the NSAID, ibuprofen, naproxen, or celecoxib. So it is very important to know that the NSAID better to take with food. This will increase the GI ulcer, and do not give NSAID and aspirin together. Let me review. Do not give NSAID and aspirin together, and stop the taking 1 week before surgery. So if your patient have to go for any surgical operation, better to stop 1 week before. Also can cause the NSAID, especially ibuprofen, indomethacin, naproxen, can cause ototoxicity or photosensitivity. So let me read something, the information I share with you about NSAID. NSAID, as I told you, better to take with food, monitor for the sign of bleeding. So if we see my patient has any kind of bleeding, we better to stop it. Avoid use with aspirin. So aspirin and NSAID not together. And also not with anticoagulant like heparin, warfarin, not together. Avoid the operating heavy machineries or contraindicated with some specific medication like aspirin, right? Or if the patient has a GI bleeding. So NSAID, what are the common side effects of this group of medication? Common side effect, they cause GI upset or gastrointestinal bleeding, okay? Or they call renal toxicity, skin rash. So let me read it. Nausea, heartburn, headache, vertigo, oliguria, gastric or duodenal ulcer with bleeding. So do not use in the patient with peptic ulcer disease with NSAID, or do not use if patient has a bleeding disorder. Also, it is good to avoid alcohol or monitor for the sign of salicylum with aspirin, right? So to compare and contrast with other analgesic or NSAID, it is important to discuss with acetaminophen and aspirin, right? First come about the acetaminophen here. So indication of acetaminophen we can buy over the counter and most popular medication. Basically, acetaminophen we use mild to moderate pain or fever. So acetaminophen mode of action, they inhibit the prostaglandin synthesis in central nervous system. The major side effect of acetaminophen, they can cause hepatotoxicity, means liver damage. But keep in mind, they cause hepatotoxicity in high doses, not the dose we use, like 500 milligram. It's okay. But if you take 8 tablets per 24 hours, this is hepatotoxic. They also cause the side effect nausea, skin rash, or jaundice. The key point we have to know, do not excrete the 4 grams per day. And many over-the-counter medication contain acetaminophen, and acetylcysteine is the antidote for overdose. Yes, it is here. Antidote for acetaminophen is called acetylcysteine. So I told do not exceed 4 grams per day, right? So let me recap it. The acetaminophen basically we use for mild to moderate pain or fever or arthritis or gout or rheumatoid pain. They decrease the inflammation as well. But when you give the acetaminophen, some note is important to keep in mind. Do not give to the patient who have liver failure or renal failure, because they can cause hepatotoxicity. The antidote of acetaminophen are acetylcysteine. You can see the name here. Also, the overdose sign are weak the pulses with clammy, cold skin. So let's go. The next important medication is called aspirin. Here, aspirin. So aspirin we also use for mild to moderate pain, or aspirin we could use for fever or arthritis, gout, rheumatoid pain, as like acetaminophen. This is the importance to study, compare and contrast. But difference between acetaminophen, aspirin has a property to work on the heart, because aspirin also used as a blood thinner, right? But it is also very important to keep in mind, aspirin do not give with other anticoagulant like warfarin or heparin. Do not give to children because uh, they can cause major problem, and this is called Ryle syndrome, right? It is name is here, Ryle syndrome. So let me recap it. Do not give to the children with flu-like syndrome because of chance to develop the Ryle syndrome, and also stop taking 1 week before surgery. So if your patient have to go for surgical operation, it is better to stop at least 1 week before surgery. So here, the let me read it about side effect: GI upset, nausea, severe allergic reaction. How you know that your patient developed the allergic reaction? To see the skin rash, itching, difficulty of breathing, tightness over the chest, swelling in the mouth, face, lips, or tongue. Sometimes black or bloody stool come because they can cause GI bleeding. The most important and most common question come in NCLEX board: aspirin can cause tinnitus, means abnormal sound make in the ear. So they can cause confusion, diarrhea, dizziness, drowsiness, or hearing loss. So aspirin has an ototoxic medication as well, ringing in the ear, right? Or tinnitus or tinnitus, severe stomach pain, or they develop the Ryle syndrome in children. So do not use for the children for fever, right? Never ever. They can cause respiratory alkalosis with toxicity. What are the key points or nursing intervention? Monitor the liver function, avoid with alcohol, and teach, educate your patient, take the aspirin with food, and report if any sign of bleeding, right? So aspirin side effect or some note is very important that I like to recap it. Do not use the patient with peptic ulcer disease or bleeding disorder, or aspirin better to avoid with alcohol, and monitor for the sign of salicylation with other non-steroidal anti-inflammatory or with acetaminophen.